Here are 9 knee problems that can actually be mistaken for an ACL injury. The first knee problem is a sprained knee. Now what a sprained knee is, it's just an injury, a general injury to any of the ligaments in the knee. It could be the ACL, but it could also be the MCL, the LCL, the PCL, and there's potentially other ligaments in the knee depending on your genetics that could be hurt. You know that it's a minor knee sprain when you recover from it dramatically within a day, and then within a few days after that, it's not even a thing. At most, they last a week. If you have a knee sprain that lasts more than a week, then there's probably something more serious going on. But if it's just a small injury that could be severe at the beginning, you might be limping, you might feel like you need to be on crutches, but if you make a massive improvement a day after, and then it just keeps getting better and better after that to where it goes away completely within a few days, then it's probably just a sprained knee. Number 2 is a meniscus tear. And I'm gonna get my knee model just to show you what I mean here. Here's a knee joint, this is the right side. This bluish thing right here between the bones is the meniscus. And the ACL is deep inside. It's that thing right there that I'm touching. So you can see it's right by the meniscus. It's behind the kneecap on the front of the knee. When you injure the meniscus, the most common signs are going to be pain on the inner part of the knee, like between your knees, but on one knee. And it usually is just one-sided. It is possible to get pain on the outside of the knee, but it's just less common. And the meniscus is also on the back of the knee, so you might get discomfort on the back of the knee. Now, a meniscus tear is usually associated with locking, meaning the knee gets locked in a position and you can't straighten or bend it. And there might be clicking and popping as you bend and straighten out the knee if you're not in a locked position. Meniscus tears can be in different severities. You can have a minor tear or a more severe tear. But what's different from an ACL tear is with an ACL tear, there's usually some mechanism of injury that's traumatic. It doesn't always have to be that way, but it often is, where somebody hits you on the side of your knee and your knee bends in a funny position, and then there's a pop or a snap associated with that, and then immediate swelling afterwards, and you can't walk or move comfortably on that knee. If you had that, it is possible that you already had a meniscus tear, or that you also got a meniscus tear at the same time, but it's more likely that you have an ACL tear if you had that sudden impact with some pop or snap. And you can have an ACL tear that happens gradually, but meniscus tears are much more common to happen in a gradual progression, whereas ACL tears usually happen suddenly. Number 3, this one's not talked about much, but I find it a lot in patients because of my training, my expertise, my specialty. This is something I call a tibial shift. So if you look at the shin, the femur, the thigh bone right here, that's what I'm holding on to at the top. Here's the kneecap, and then you have this bone right here, the shin bone. It's called the tibia. It's what makes the bottom part of the knee. That tibia can shift side to side. There's a little bit of ability for the knee to move side to side, and when that happens, it messes with the alignment of the knee, and it can put tension on the ACL as well. Well, if you have a tibial shift, usually it shifts this way, it can't shift the other way as well. Then there's bad tension on the ACL, there's bad tension on the meniscus, and this can be corrected. We correct it here in the clinic all the time, and people can have a near instantaneous improvement in their knee pain. But when the tibia is shifted, it can feel like you can't bear weight on it, you can't bend it all the way because of the alignment problem. It just can look like an ACL tear, even a meniscus tear, but we know that it's not an ACL tear when we shift it back in position and all the motion's restored, pain is dramatically reduced, and then we'll do ACL tests by hand as well to verify that there isn't an ACL problem, because that's what we can do here in the clinic. Number 4 is knee tendonitis. This right here, this is actually a ligament because it connects the patella, the bone, to the shin bone, but sometimes it's called the tendon. You can get tendonitis right here, you can get tendonitis above here, and there's other tendons. Tendons just connect muscles to bone, whereas ligaments connect bone to bone. If you get irritation in those tendons, it can be mistaken for an ACL tear in some people because it can get very severe and cause swelling and not allow you to put weight through your leg in severe cases of tendonitis, and that can mask as an ACL tear, especially if you had an additional sudden motion or somebody hits you. It can really flare up a tendon that was already pre-injured, and then it got very flared up with some accident that happened or some bad step, a bad landing from a jump that you took. That can set off a tendonitis flare-up. Number 5, which is related to the tendonitis, is knee bursitis. Around the knee, there are 4 big bursa. Bursas are just fluid-filled sacs that allow less friction to happen between tendons and other tendons and muscles and bones and other things. It just allows for more free movement for all the structures in the knee. But if there's too much pressure going through these bursa, which is the same problem that sets up the tendonitis, the bursa can get inflamed, which is what bursitis means. It means bursa, and then itis means inflammation, so bursa inflammation. Those can get swollen as well, and it's the same root problem that causes tendonitis and bursitis and meniscus tears as well, and a bunch of other knee problems that I'm going to go into next. Number 6 is the fat pad. There's a fat pad right here where I'm sticking my finger behind the patellar ligament right here, and that fat pad's supposed to be there. Some people get concerned and self-conscious when I tell them they have a fat pad in their knee. It's there for padding and to fill up some space. It serves some nerve function as well. There's a bunch of different reasons for the fat pad right there, but it can become inflamed on its own, and because it's so close to the inside of the knee, it's relatively on the front though, it can be mistaken for an ACL tear. Fat pad irritation tends to be very sensitive to the touch. It tends to be superficial, and what people will say is they bump their knee like on the edge of a table or on a chair or in the car, getting in and out of the car, and that can kick it off. That's how we can usually tell fat pad irritation apart, is it's irritated, it's flared up by a bump to the knee, almost a trivial bump, like something that normally wouldn't bother you, but all of a sudden this kept it inflamed for a day or two. Fat pad irritation usually goes away after a day or two as long as you're not irritating any further, but there are muscle imbalances that put too much stress to the knee and keep the fat pad irritated. And these same muscle imbalances, by the way, can make an ACL more tensioned. The anterior cruciate ligament it's supposed to have some tension on it, but it can take on more tension than it's supposed to with these muscle imbalances. Number 7 is patellofemoral pain syndrome. Now, this is a weird diagnosis. It was named a long time ago, but these days we're finding that it's just a general diagnosis for pain anywhere on the front of the knee. If people have knee pain for the first time and they go to the doctor might do an x-ray or an MRI and say you have patellofemoral pain syndrome, or even before they do those scans, especially before they do an MRI, because that's what's used to diagnose an ACL tear, they might call it patellofemoral pain syndrome. They might call your condition that, PFPS for short. It can cause swelling in the front of the knee, and it can limit how you're walking and how you're moving and any sort of physical activity. And so that's why some people think sometimes they have an ACL tear when it's actually an overload of pressure on the front of the knee that's causing irritation to the area. Another name for patellofemoral pain syndrome is runner's knee, because often runners will get this, but it's not limited to runners. People that don't run regularly for exercise can still get pain in the front of the knee that they might call patellofemoral pain syndrome. When patellofemoral pain syndrome progresses enough, it can set up number 8 here, which is Chondromalacia Patella. Chondromalacia means shrinking cartilage, and then patella means on the back of the kneecap. So there's cartilage on the ends of the bones here so that the surfaces of the bones move smoothly on each other. And if there's too much pressure going through the back of the kneecap right here because of dominant muscles as part of the imbalance, then it can compress the cartilage. And cartilage is made out of water largely. It's like 70% water. And so when you compress it, it's like squeezing a dish sponge. You can squeeze all the water out, which makes it it doesn't work the same way. It's not as slick, it's not as smooth, it's not as cushiony. And so that's why it can appear thinned out or even become damaged. They'll find that on an x-ray or an MRI, and that's how the doctors will label this as Chondromalacia Patella. But fixing the root muscle imbalance, the same one that can affect the ACL tension, is what can take pressure off the back of the kneecap to allow that cartilage to restore its normal thickness and to restore its normal slickness as well, so that it smoothly moves over the end of the thigh bone right here without causing friction and grinding. And then number 9 here, this one's the one that gets overlooked probably the most in my opinion. This can mask as an ACL injury. It's saphenous nerve irritation. The saphenous nerve runs from the front of the thigh, and then a part of it, a branch, hooks a little bit behind the inner part of the knee, and then there's a branch called a recurrent branch that whips around the front of the knee and all the way across. It goes right across the meniscus, right in front of the joint line. This nerve often gets overlooked by healthcare providers because they're not looking for it. They're not trained to look for it, and it can cause pain in a large area, but very often right in the front of the knee. People get confused with these symptoms because they'll think that it's a meniscus problem, they'll think that it's tendonitis, they might investigate an ACL tear, and oftentimes what people experience when they have a saphenous nerve injury is swelling, discomfort, movement hurts, pain at night, pain with just sitting around. It can drive people crazy because they don't know what the root problem is. And it could be coming from the spine, it could be coming from the hip, it could be a problem in the knee, it could even be an issue down in the foot because there's a branch of that saphenous nerve that runs all the way down into the inner ankle and even the arch of the foot. And if you have a foot problem, it can tension that nerve and it can produce symptoms in the front of the knee. So watch out for that saphenous nerve problem. It can be a tricky one. I have videos on just about all of these conditions that I've listed here today. I'm going to put links to playlists of videos. If I have multiple videos, I'm going to put them all in a playlist for you. They'll be down in the description below. So if you think you have a saphenous nerve problem, for instance, or Chondromalacia Patella, or if you want to learn more about ACL problems, I have lots of help for you here on this channel. Go find the links for the playlist that best suits you down in the description below. I've also got online programs that go even more in depth into these problems because you can fix all these problems without surgery, without relying on pain medications, or having to go to the doctor's office all the time to get an injection for knee pain. You can learn how to fix this problem naturally at the root by fixing the muscle imbalances that are putting too much tension on all these problems in the knee. Go find out more in the description below. Thanks friends for watching this video. If you found this video helpful, give us a thumbs up. Please subscribe to our channel if you haven't yet, and hit that notification bell so that you don't miss out on any of the helpful videos that we post each and every week. Please share this with somebody. If you have a friend or a family member that's suffering from knee pain and they're confused about what it is, they think they might have an ACL tear, please share the link for this video with them so they might learn more. Thanks so much for watching, friends. I'll see you in the next video. Bye-bye.